We're gonna teach you how to be safe when driving. Come take a ride with us.
For phase 1, the shoulder girdle is in neutral starting position. The shoulder is neutral, the elbow is flexed, the forearm is pronated, the wrist is neutral, and thumbs and fingers are also neutral. To complete this phase, there's upward rotation and protraction at the shoulder girdle, flexion at the shoulder, flexion at the elbow, supination at the forearm, no motion at the wrist, flexion at the thumb, and flexion at the fingers. The ending position for this phase, the shoulder girdle is upward rotated and protracted. The shoulder is flexed, horizontal adducted, and medially rotated. The elbow is flexed, the forearm is neutral, the wrist is neutral, the thumb is flexed, and the fingers are flexed. A prime mover of this phase is the biceps brachii, which is located in the anterior humerus with the origin of its long head at the supraglenoid tubercle of the scapula and its short head at the coracoid process of the scapula and its insertion at the radial tuberosity. The main motion of this muscle is flexion, and it's a concentric contraction during this phase.
Starting position for phase 2 is the same as ending position for phase 1. The motion at the shoulder girdle is downward rotation and protraction. The motion at the shoulder is lateral rotation, extension, and horizontal abduction. The motion at the elbow is extension. The forearm has no motion. The motion at the wrist is extension. And the motion at the thumb and fingers is flexion. The ending position for phase 2 is shoulder girdle is downward rotated and retracted. The shoulder is hyperextended, elbow flexed, forearm in neutral, wrist extended, thumb flexed, and fingers flexed. The prime mover of shoulder lateral rotation and horizontal abduction in phase 2 is the infraspinatus muscle. It has an origin on the infraspinous fossa of the scapula and an insertion on the greater tubercle of the humerus. This muscle has a concentric contraction during phase 2.
The starting position for phase 3 is the same as the ending position of phase 2. In order to complete this phase, the shoulder girdle does upward rotation and protraction. The motion of the shoulder is flexion. The motion of the elbow is extension. The motion of the forearm is pronation. The motion of the wrist is extension. The motion of the thumb is extension as he is letting go of the seatbelt. Then he flexes his thumb as he is grabbing onto the key. The motion of the fingers is extension as he is letting go of the seatbelt. Then he flexes his fingers as he is grabbing onto the key. In phase 3, the ending position of the shoulder girdle is upward rotated and protracted. For the shoulder, the ending position is flexed, the elbow is flexed, the forearm is pronated, the wrist is extended, the thumb is flexed and adducted, and the fingers are flexed. In phase 3, one primary mover of the elbow is the triceps brachii. It is located on the posterior side of the humerus. The origin of the long head is on the infraglenoid tubercle of the scapula. The origin of the lateral head is inferior to the greater tubercle on the posterior humerus. On the medial head, the origin is posterior surface of the humerus and it is deep. The insertion of the triceps brachii is the olecranon process of the ulna. During this phase, the triceps brachii does extension of the elbow and it is a concentric muscle contraction.
The starting position for phase 4 is the same as ending position for phase 3. In order for this phase to occur, there is no motion at the shoulder girdle, no motion at the shoulder, no motion at the elbow, supination at the forearm, flexion at the wrist, no motion at the thumb, and no motion at the fingers. The ending position for phase 4 is the shoulder girdle upward rotated and protracted, the shoulder flexed, the elbow flexed, the forearm in mid position, the wrist neutral, the thumb flexed and adducted, the fingers flexed. In phase 4, one primary mover of the forearm is the supinator. It is located on the anterior surface of the forearm. Its origin is on the lateral epicondyle of the humerus and adjacent ulna. Its insertion is on the anterior surface of proximal radius. Its action is forearm supination. During this phase, the supinator acts to supinate the forearm through a concentric contraction.
The starting position for phase 5 is the same as the ending position for phase 4. The motions for this phase is retraction and downward rotation of the shoulder girdle, shoulder extension and abduction, elbow flexion, forearm pronation, wrist extension, thumb flexion, and finger flexion. The ending position for phase 5, the shoulder girdle is in neutral, the shoulder is flexed, the elbow is flexed, the forearm is pronated, the wrist is in extension, and the thumb and fingers are in flexion. One of the main muscles for shoulder abduction in phase 5 is the deltoid. The three parts of the deltoid are the anterior, the middle, and the posterior. The origin of the anterior deltoid is on the lateral third of the clavicle. The origin for the middle deltoid is on the acromion process of the scapula. And the origin for the posterior deltoid is on the spine of the scapula. They all insert on the deltoid tuberosity of the humerus. All the deltoid muscles work to perform abduction of the shoulder while reaching for the shifter. This muscle contraction is concentric.
The starting position of phase 6 is the same as the ending position of phase 5. The shoulder girdle performs retraction, the shoulder joint performs more extension, the elbow flexes more, and the wrist, thumb, fingers, and forearm have no motion. The ending position for phase 6, the shoulder girdle is retracted, the shoulder is hyperextended, the elbow is flexed, the forearm is pronated, the wrist is extended, the fingers are flexed, and the thumb is flexed. A prime mover for phase 6 is the flexor digitorum profundus. The flexor digitorum profundus originates on the upper 3/4 of the ulna and inserts on the distal phalanx of the forefingers. The flexor digitorum profundus performs flexion at the MCP, PIP, and DIP joints and keeps the fingers flexed for this phase. The flexor digitorum profundus does an isometric contraction because there is no motion of the fingers.